This is the EMS Research Vlog and Podcast, where we talk about the research-related issues that matter to those who work or study in the area of emergency medical services. Your host is Bram Duffy, who is a paramedic and communications professor.
Welcome to the EMS Research Vlog and Podcast from the studio here in Houston, Texas. I want to start out by drawing your attention to our website where you can check out anything that's show related when you go to professorbram.com. That's professorbram.com. At the website, you can find the latest show, see my talks in the media, order the latest book, and also look at how to participate in research. This is all stuff that can help you grow in the world of EMS research. Like right now, I have a research study open for first responders. So if you don't mind being interviewed by me, then go to my website at professorbram.com and click on the current research tab to apply. Joining us today is TEGAN MANSOURI, a clinical assistant professor at the University at Buffalo and a registered dietitian with a passion for advancing our understanding for health and wellness. TEGAN has dedicated her career to exploring this intricate connection that happens between diet and shift work and overall well-being, and specifically among EMS providers. And we know that that's a demanding schedule that folks automatically make assumptions about when it comes to the health challenges that are attached to that. And TEGAN's groundbreaking research has led to several notable publications, including, I just want to read these titles because it's so impressive. One is The Impact Plant-Based Diets Have on Athletic Performance and Body Composition. Another one is Eating and Physical Activity Patterns in Day and Night Shift EMS Clinicians. Another one is a multi-method approach to understanding the relationships among sleep, eating, and shift work. And her work also includes the powerful study that's eating patterns among EMS providers in the United States. It's a qualitative interview study where she looked at lived experiences of EMS workers and some of the factors that shaped those eating behaviors. And throughout her research, TEGAN continues to contribute just really awesome insights into how diet and workplace dynamics sort of affect health. We are honored to have her on the show today to discuss her work and her findings and really the significance of improving the well-being of those that dedicate themselves to doing what we do, right? So welcome to the show. Dr. TEGAN MANSOURI, gosh, tell me all about you and your passion for nutrition.
First of all, thank you so much for having me on the show today. I'm really honored to be here. Like you said, I have a passion for nutrition and I love working with people, and it is something that I really just overall love to do is have the opportunity to talk about the research that I've done and talk about this population of very hardworking, dedicated people who are up against so many challenging factors. And I think it's really important to address that nutrition for anybody is not simple. And then when there are very challenging work conditions, it makes it even more overwhelming. So I am more than happy to discuss this topic. And I do a lot more teaching these days than research, so I love being able to talk about the research. So thanks again for having me. I'm excited.
Well, yeah, I'm glad that we can connect like this. And really, the folks that are listening, a lot of us are EMTs and paramedics doing the shift work. So now you got to do the research and tell the target audience about it. And I'm really excited because you produced this and published this in Nutrients. And so it's not just a small journal. This was a very reputable big study. In 2022, this was titled Eating Patterns Among Emergency Medical Service Providers in the United States, a qualitative interview study. And I want to read some of what came from this, because The researchers that you led here used interviews to gather data from 40 EMS providers across the country, and participants had to meet criteria like being active in patient care and working in EMS, and then also to ensure a broad range of perspectives. The sample included providers from a diverse group of locations like urban, rural, backcountry, and also those working in very kinds of shifts. So 8 hour, back to back, 24-hour shifts. And so during in depth interviews that they conducted via Zoom, participants shared how factors like fatigue and stress and unpredictable work schedules influence their eating behaviors. So, for instance, many described relying on fast food or convenience snacks when hunger struck, especially during a busy night shift when there's just no other place to eat. And the researchers used coding methods to analyze these discussions, identifying really the reoccurring themes that were there. And that's what tied to factors like physical fatigue, workplace culture, and even the physical environment. And the findings revealed that there is an urgent need for changes at multiple levels. So many providers reported that hunger and exhaustion prevent them from planning or preparing healthy meals. And at the same time, stress leads to poor food choices. The study also highlighted the role of ambulance posting or limited access to kitchen facilities as real barriers to eating something that might be nutritious during the shift. So, by developing a model based on the interactions between the personal, workplace, and environmental factors, the research helped to emphasize the need for a tailored kind of intervention. So, some of the recommendations that came out of this were um, providing access to healthy snacks, implementing nutrition education programs, and rethinking the work schedules to allow for adequate rest and recovery. But overall, the study underscored a critical need that's there to improve the health and well-being of EMS workers, not only to enhance their quality of life, but also to support the sustainability and the efficiency that um, is required in an EMS system. And I know a lot of people think about this topic, but you really dug into this as a research. And so, can I just ask, as far as my description of the study, did I get it right? Can you expand more on what happened in your study?
You did a great job summarizing the study. And to give you a little bit of a background of how I got into this work, and kind of how this study was developed, it started as I was working towards my PhD, and the chair of the department I was in proposed a study to look into nutrition among EMS providers. He has a background as an EMT and a volunteer firefighter, and he does a lot of work with emergency responders through more of a physiology lens. And so when he proposed a study to look into nutrition, I as a student had a lot of interest in, of course, nutrition and also studying the role of sleep on eating patterns. And so I thought the study sounded really interesting because of the inherent shift work aspect of EMS work. And at this point, I had no real background or not a lot of exposure to the field. So the first study we did together was just looking at, we had 40 participants, and we had them keep a food log and wear activity monitors. So we were able to look at everything they had to eat and drink during a shift and off their shift, and their activity levels. And so that study was really eye-opening to me. just also through the interactions I had with participants in the study who expressed so much gratitude that the research was being done in this area. And that really underscored the importance of it. So it was clear that this work needed to be done, and we needed a follow-up study where instead of just looking at what providers were eating, we asked the why and how do they and can they eat on shift. So yeah, go
Yeah,
on.
I have a comment more than a question. It's just a
Mm.
comment because I want to share that, a lot of time qualitative research gets flack, but in this world and what's happening right now with this topic, I feel like that, everybody knows that obesity is a big problem. Everybody knows that, injuries and on the job are a concern and that's related. And everybody knows that burnout on the job is another whirlwind that conflicts with this. I started EMS years and years ago, and I went from being a vegetarian to being a full converted meat eater because it just came down to the fact that I was hungry all the time. There was no other way to eat unless I ate bad sometimes. And so it is just, the fact is that the quantitative data is out there that we need help. And so to be able to figure out how to get us help, I think this takes a good step forward because otherwise, um, experts like yourself who haven't lived this environment don't don't know how to help us address this. And so I want to ask you here, how did the conducting this study sort of shape your understanding of, well, the EMS profession and what the challenges are out there?
Yeah. So like you said, the it's so important for the researchers and the clinicians that are maybe like the dietitians, the primary care physicians, they know about the lived experiences of the patients they want to help. And so I went into this study knowing that there were structural factors stacked against providers that would make it difficult to maintain a healthy diet and healthy sleep, consistent sleep patterns, and consistent exercise plan.
Mhm.
And yeah, so like those kind of factors that I mean are like the schedules, the shift work, the environment, particularly when posting, just the work demands and the unexpected nature of the job. Um, and the more I talked to providers, the more I began to realize the extent of this and the weight, and also just the context that this already very challenging work exists in, where providers are constantly asked to do more with fewer resources, fewer protections, and continue to be underpaid and underappreciated to a large extent, and the impact this is having on the workforce. And it's no wonder why we're seeing more and more people leaving the field.
So hang on, it sounds like to hear you talk that you sort of feel for us. You sort of, I guess you've got to know enough about this now that do you feel like you're one of us and you have some empathy for what it's like on the job?
Definitely am not one. I like, I have so much gratitude and appreciation for providers because just from listening to people talk and people who are so dedicated to
Yeah.
this work and care so much, and they continue to do it because they care and they want to be the the comforting, competent, efficient provider that's there during someone's worst moments. We need those people. We need people who are willing to do this. And if we aren't acknowledging um, the root cause of the high rates of turnover and burnout, then we aren't going to have this essential workforce that we need so much. So yeah, it was like the weight of it all really
Well, thank
stood
you
out to me.
for, yeah, I appreciate you helping us be healthy because
Mm.
we at the root of it, we all want to be healthy able to be active and feel good, and nutrition is a big part of that. We recognize that. I think a lot of us are in denial, otherwise. And so the other thing about your study, I you had 40 participants, right?
40.
40, yeah. So I have managed large qualitative studies before, and I know that 40 is very, very big deal. And so I'm just saying that because you really, and obviously made the net wide and wanted to really gather all the morsels that you could. So this was a spectacular effort. I would go so far as to suggest that maybe you did too many, because you don't. I don't know that. I'm kind of curious, like why that's like such a large number, but with but nonetheless, with such a large volume of this qualitative data, I'm just wondering for you to tell me about it. How did your team look at things like consistency, and how did they do the analyzing part uh, to pull out the participants' experiences? So tell me more about just that mountain of data and going into that.
Yeah, it was a lot for sure. And there is so much variation in from one provider to the next, which you know better than me, that conditions will vary so much depending on location, day shift versus night shift, rural, urban, backcountry, or there's so many factors that impact, 24-hour shifts, 12-hour shifts, 8-hour shifts. There's so much variability. And so it was the idea is to continue to interview people and collect data until you meet data, saturation. You keep seeing the same themes over
Right.
and over again.
So
And
so can I
but
ask, is that was that the plan that you worked to reach data saturation, or when you set up your study, you already had 40 as kind of a number as a goal?
so it originally started with a plan for focus groups, and
Yeah.
we realized we could get it. It made more sense scheduling wise and in terms of the nature of the questions we were asking, and the just it made more sense to pivot to interviews. And so we had more of a plan. We had kind of 40 in mind with, maybe doing 4 groups of 10 or so.
Hmm.
But then as we were collecting interviews, that was kind of like a general goal, but the ultimate like metric of when to end was that we were beginning to see the same themes over and over again. And so it's maybe kind of a messy answer to your simple question
Well, it
of
sounds like both things kind
why,
of were
but
happening,
yeah,
because you're
exactly.
telling me that you got to data saturation and you start and you were, either way, you were lucky enough to get that kind of a big data set. I'm thinking about the focus groups that I've conducted, and my magic number is 7. I know you didn't do focus groups, but I don't like to do more or less than 7. That's like the number for especially like analyzing later. So I just know that this was a massive undertaking. And so your study identified fatigue, stress, and the work environment as the major factors here that really made eating habits a problem. And so, was this what you were thinking it would be when you were looking at your initial hypothesis? Because fatigue, stress, and the work environment um, that makes sense to me. Just that's a significant. Those are all significant. I can think of other things too, though. And so, tell me more about how this all came together.
So we didn't have an initial hypothesis. The goal was to learn about just having providers tell us the factors that impact diet from their perspective, um, because they're the ones living this and experiencing these challenges day in and day out. And so, as someone with a background in nutrition and eating behavior, I had particular interest in looking beyond, again, like the what somebody's eating and learning about why and how sleep played a role and the work demands and the stress and the unstable, maybe inconsistent environment. And so, there's a clear connection between sleep and poor sleep quality and stress and health. And it doesn't always seem, that nutrition will, like, it's not like nutrition is going to necessarily prevent poor sleep or anything like that. But there is this bi-directional relationship where, diet is affected by fatigue and stress and all these other factors. And diet can also maybe moderate some of these negative effects of fatigue and stress. And so there were more factors that we identified than like other than fatigue and
Mhm.
stress in the environment. We really wanted to narrow down maybe the most impactful. And so I wouldn't say that I was necessarily surprised to like find that fatigue and stress and the environment was so salient. I think the what I learned the most about was the overall kind of like organizational factors that trickle down and impact employee work-life balance, burnout, and how that kind of leads to like how that impacts nutrition and diet and how that can lead to rates of turnover and just burning out.
Well, I don't know if I know that you suggested some interventions in your article, and I remember access to healthy food was one thing, and maybe a scheduling change, but I don't know if you made mention to this. So let me throw this out there and see what 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 your take on it is. I am a proponent of an organizational culture change. And I believe that that if you look at this issue on an organizational cultural level, that everything else has the potential to fall in line after that. Like I worked in EMS environments that, yes, we had 24-hour shifts, but we also had opportunities to take 1 hour for weightlifting. And of course, some people are able to bring food and others aren't. And but a lot of work environments do have, abilities to do food options, especially as a group. Or so I would just say that from living in the EMS and fire environment for over 20 years, that um, the culture of the employer can really help. And so, uh, did you feel like that there was a blaming or an excuse, or did folks just admit that they are choosing to prioritize the job over their personal health? Tell me more about the where you're at with these interventions, and um, how things could be improved for folks.
I definitely wouldn't say like I didn't experience a lot of blaming. It just stood out to me by talking to people from different agencies and different who experience different cultures, how much of an impact that played on diet and health behaviors like exercise and things like that. Um, so I definitely agree the culture is so important and impactful, and it is a top down kind of thing where if there isn't a lot of support from management, it can be hard to feel a lot of kind of a positive culture, I guess, at work.
Yeah. And there are things that I see that are done. Like, I know, for example, at Houston Fire Department, we have a lot of fire stations that have the fire crew and the EMS crew in the same firehouse. And so that ambulance can potentially be so busy that they just get worked nonstop. And so the organizational culture is set up so that a lot of times the fire guys that are at that same station will sort of take care of the chores or take care of some of the things that the other EMS folks would normally have to do at the station, because they want to give them a chance to nap, right? Because
Mhm.
any chance they have to nap is good. And so it's sort of like, taking care of their coworkers in doing that. So I really like that at least that's a part of culture that um, can be supported in a positive way. The other thing is just when you have systems that are ran by dispatchers who are always just sending the closest ambulance every time. If just from an administrative level, looking at the dispersion of workloads so that folks get breaks sometimes, and so there are
Mhm.
lots of examples from an administrative level to a all the way through to how how folks interact on shift, with this topic. And I know that that one of the reasons that I am able to eat correctly ish on my job is only because I am surrounded with people who are also thinking about and talking about being healthy. And
Mhm.
so if we're thinking about it and we're talking about it, and I mean, we're just part of that. And so when we talk about organizational culture, I just want to say, gosh, it is who we surround ourselves with. And it can be influenced at every level. And I don't feel like we're winning right now. So
Mhm.
I like these as um, I like these as options
Mhm.
to think about for making things better. So as a nutrition expert, how how would you give advice to EMS workers who
Mhm.
have all of these things that are extra in their life, and especially when it comes to eating right and sleeping and any time for body activity, the overall health. And when I think about my friends that work in EMS, I think about two categories. I think about folks who are interested in trying to build muscle,
Mhm.
and they're sort of motivated for health concerns to think that way. And then another category I think about are folks that are just trying to lose weight, right? And so for folks who work in EMS that deal with all these struggles, tell me, like, for, how what is your advice for the person trying to
Mhm.
build muscle, and what is your advice for the person trying to lose weight?
Yeah, so I would say for both categories, the person trying to build muscle and the person trying to lose weight, it is so important to be prepared because you do not want to catch yourself going more than 4 hours without eating. It is important to have snacks and meals available when possible, because if you go beyond 4 hours, and you start to get really hungry, and it affects, executive function and your ability to make those quick decisions, especially when it comes to what you're going to eat. You just want to eat what's there and fast and easy. And that's understandable. I mean, that's physiology. It's not a personal failing of choice if you are so hungry and you choose the pizza. That's what I would choose too. So be prepared for either case. Um, bring bring like snacks that are high in protein so you can have protein throughout the day, like protein bars. It doesn't have to be anything super fancy. All day protein bars are a great option. Maybe some nuts if you and your partner, or maybe you shouldn't be eating nuts in or high allergens in the ambulance, but
I do,
um
so I'm sorry to say.
okay.
I
No, I
love
don't
those
know.
as
I don't know
snacks.
the rules.
Yeah, we
That's
do.
good. Okay, so bring some nuts are a good snack to have. Um, you know, People talk a lot about protein. Protein's important to have throughout the day for, again, both categories, the person trying to lose weight and the person trying to build muscle. Um, Carbohydrates are also going to be important to make sure you're getting all the nutrient and energy you need during a day. And of course, too, for the person who is interested in building muscle, it's going to be important to make time for that consistent resistance training. And, it's another thing to add on to maybe set aside an hour to go to a gym, but finding ways and people who are, like you mentioned with the culture is so important, and finding
Mhm.
somebody who can maybe hold you accountable or work out with, and something that you look forward to, that's hugely valuable. Don't be so hard on yourself if finding it very hard to stick to eating nutrient dense foods. Reach out to me or a dietitian that in your area, um, because somebody can help provide tailored guidance for you and help make more suggestions about what foods to eat and foods that you enjoy. But batch cooking is another really useful strategy. So if you have a
Mhm.
day off, cooking a pot of brown rice or quinoa, and maybe shredding some chicken, put some chicken or a protein in the crock pot with a sauce that you like, roast some vegetables. Like, those are all things that don't take a lot of effort, and can provide you with several meals throughout the week that you don't have to think. You just grab and go, because when you know you're really busy, you haven't slept a lot. It's really hard to make extra decisions. So taking that out of the equation as much as possible is always ideal.
Okay, so we're
And then
talking about how we need to eat every 4 hours. So that means we just basically think about food all the time, and we have to plan ahead. And planning ahead means that I am gonna have something that's ready to eat, or a plan to eat before the moment gets there where I'm ravenous for food. And then if I'm building muscle, I need to be active and find time to do that too. I guess those are the big things. But I also want to say, I was just trying to summarize some of what I got out of that, but also to say that, you know, I kind of heard out of that talk that if I order a number one from McDonald's or from Burger King, I might be okay there too. Like, can I do that? What if I, what about, for example, um, I hate to put you on the spot, but I mean, is it healthy? Can I order a hamburger with all the vegetables and just maybe not put the sauce on there? Is that because that gives me the carbs, the vegetables, and the meat? If I'm in an environment, where I need those things, is is that an okay option to go for?
so it's better than not eating anything. It depends on the person. I'll put that as a disclaimer. It's okay to do. It's when that is all you're doing all the time that may begin to cause issues.
Hmm.
So if you are in the moment, you have no other option, and you have a burger, um, that's going to be the nutrition you need at that time. If that's what you're eating 3 meals a day, every day of the week, it's going to be a lot of saturated fat, not a lot of fiber, not a lot of the vitamins and minerals that you need for your body to function. And so it's more about like what you do every day that is putting somebody at risk for diet related illness. If you have a burger, it's not going to cause heart disease, right? But if you're eating the same burger every single day, that can put you at greater risk. And in terms of the sauce, I mean, if you like, small modifications go a long way. So if you are finding that you can't make a huge change, small modifications are a great place to start. And it adds up over time. But yeah, one other thing I'll say too is, I know that all the suggestions I made are things that I just said are inherently hard for this job, right? Planning, thinking ahead, eating every 4 hours when you may be busy for a 12-hour shift. And the idea is, yeah, it is hard. And it doesn't just come down to individual choice. Like, there are system level changes that are needed, and it's important to advocate to our local representatives and politicians to take these issues to DC and talk about funding from CMS for ambulance provisions. So yes, like, I know that I said planning, and that's a pain. And just want to also acknowledge it's not just the responsibility of the provider, and there are people that can help too. Like I said, email me, and I'm happy to provide resources and all that.
Well, I want to say that I know a lot of folks who live on a diet of meat and energy drinks. So could you just, I don't know, would you speak to that audience maybe? That way, we get that group into, because those energy drinks are pretty much the lifeblood of EMS
Mhm.
nowadays.
Yeah, right. And so you need caffeine. If you're working and you're not able to sleep, like I'm not telling you don't consume caffeine. Um, Balance is a great place to start. So if we're only eating burgers and drinking energy drinks, that's a lot of caffeine. If there's if there's a lot of sugar in the energy drink, it's a lot of sugar. And we're eating burgers, that's a lot of saturated fat. Things that are okay in moderation, but if that's all we're getting, we are putting ourselves at risk for we're putting a lot of strain on our heart. Simple things you could do to help your heart are eating more foods that are higher in fiber. So some foods that are higher in fiber, fruits, whether it's a banana, apple, orange, simple things, or maybe you like something that's more seasonal. That's great. Not picky, but any amount of fruit. Um, Fresh vegetables, frozen vegetables are great. They're just as nutritious and they're cheap and they're easy. And you can add a sauce to them and they'll taste better if you don't love the plain taste of vegetables. Um, Whole grains. So if you eat bread and you don't mind trying whole wheat bread, that's a great place to start. That's adding some fiber. That's going to help
Clear your
reduce some of the
system.
inflammation. Yeah, it's so important. It'll help. Like you meant it. It goes a long way for just systemic inflammation. And so increasing fiber in those ways, adding some vegetables, fruit, whole grains, in any way that you can. Don't try to change everything all at once. Just take small steps. And adding more fiber is going to help a long way. You don't just need to focus on like cutting things out right away. Just try adding more fiber.
Yeah, and there are diets out there, like the firefighter's diet is a popular book out that's been out for a long time. And the way that I read that is a pretty aggressive, lifestyle change. And I like your approach about how, just try things, just work at it. And as healthcare providers, we actually all do know we're supposed to be drinking water and eating
Mhm.
nutrients, but at the same time, not everybody's able to put themselves, first, when they have so much that they're responsible for. So I
Exactly.
appreciate you helping us think through this and helping us be more healthy providers ourselves. So I really thinking about the cultural element to this, and I'm thinking about the organizational elements that are involved in this, and now the personal elements of planning. And it's hard to do stuff on your own, right? I mean, I'm not a smoker, but I know if I were to stop
Mhm.
smoking cigarettes, that I wouldn't be able to do it if my best friend smoked cigarettes too. So, so,
Exactly.
so
Yeah,
because it's a team effort here. But uh,
definitely.
before we close, is there anything else you want to add or share to this topic?
I just want to thank you for having me and getting to talk about this. And hopefully, um, that everything I said wasn't just the same old, like, eat more vegetables. But I also just shout out to everyone that participated in these studies. Are, they'll- they are doing so much. And like you said, too, th- this is the population of people who are helping other people day in and day out, and they don't always have the space and capacity to look out for themselves. And like, that's not their fault. So just don't I mean it's don't be afraid to ask for help. I know it's easier said than done, but if you put my email out, people are more than welcome to reach
Yeah,
out to me. I'm happy to talk to anyone more about this topic.
for sure. I'll put your email in the notes below, and I appreciate again all the work that you're doing on this. So thank you.
Thank you. Thank you for this podcast. This is awesome.
Like many of you, I'm also an EMS instructor, so I know what it's like to have topics that are important to cover but are not actually in your curriculum. So when it comes to EMS research, I want you to know that I've been joining EMS classes lately in a virtual kind of way. It's fun for me to meet your students and talk about EMS research or even talk about how things are done differently where I am versus where you are. So if you're an EMS instructor like me and you want to give your students a flair of what EMS research is all about, just fill out the inquiry form on my website at professorbram.com. This is professorbram.com, and I'll be in touch. I want to also invite you to check out my latest book. I co-authored it with Four Arrows, who has 2 doctorates and is an expert on indigenous scholarship and hypnosis.
We've got to look at each individual patient as a human being who is in need. And we've got to know that when we're in need, we do look to others, no matter how self-reliant we are. If we are in a situation that we've never encountered before, that self-reliance begins to seek, is there anyone that can help me with this situation? I mean, you've used a pretty drastic example with the arm cut off, but I don't care how much skill you have. There's very few people who would be able to not say, "Oh my gosh, I need help," and then all of a sudden someone shows up
with a badge.
Yeah, and you think, well, maybe this is someone that can help. Well, you said that, and I said that, during the first hour of trauma, people are essentially in a state of what we now know is hypnosis state.
I want to invite you to check it out because we introduce a method for communicating with patients on the scene of the emergency that takes advantage of some of the properties found in hypnosis. The book works to change the way we approach and interact with any emergency patient who's in acute distress, and it can help you be a better practitioner. The book is called Hypnotic Communication in Emergency Medical Settings for Life-Saving and Therapeutic Outcomes. Follow a link there below to find it, or you could get it almost anywhere books are sold. And if you contact me, I would be happy to mail you an autograph sticker designed to be put into the jacket cover.
Hi, I'm Will Chabot from the International Pre-Hospital Medicine Institute. You might know about us because of the literature reviews that we post every month free for your review on our website at iphmi.com, and also published through GEMS Online Magazine every month. We've been doing them for 5 years, so now we've accumulated over 240 literature reviews over the past 5 years. And we've gotten feedback from our audience that said they'd like to have these things as desk references, so they'd had a rapid reference. Well, we've done it. And there are now 5 volumes of these books, one for each year that we've been publishing them. This is the latest version, volume 5. And as I said, in each of these, there's at least 48 literature reviews. They're all cataloged in the beginning of the book, so you can see what the topic area is, what pages those reviews are on, and how you can find them quickly. And again, these are a great reference, whether you're putting a lecture together, working on a paper, studying, whatever it is. This gives you the depth of field of the science that dictates what we do in the field, or what we should be doing in the field, or why we've changed the way we do things in the field. In any event, as with all of our publications, we've priced these because we want you to be able to have this book. It's only $4.99 in the hard copy here, and all 5 of them are available at that price. But you can also get them as ebooks, and they're available as ebooks from Amazon, from Apple, from Barnes and Noble, wherever you get your ebooks for the price of $2.99. So again, we don't do this with an aim towards getting wealthy. We do these because we want you guys to be able to have these materials, relevant information, affordable information, and an access so you can get to it. So if you want the hard copies, go on Amazon, $4.99. Go to your ebook store and you get it for $2.99. If you're in the business, this is the kind of material you want to have around to settle those firehouse arguments or to help you put your materials together. Thanks again. See you all soon.
I'm doing a research project related to first responders who live in the United States, and I could use your help if you don't mind being interviewed over a video call. Go to my website and fill out the form. It's at professorbram.com, professorbram.com. I just want to thank you for listening, and I look forward to sharing more insights with you in the next episode. If you enjoy EMS research, please tell your friends and like, share, and subscribe to help others get the message.